Greetings, class. So, for today, my topic is MRA. So, I'll be covering topics like what is an MRA, why do we need an MRA, how it functions, and also an article which discusses about this technology. So, MRA, magnetic resonance angiography. So, it is also a type of MRI. So, MRI is nothing but it's called magnetic resonance imaging. So, both are different. MRA is called magnetic resonance angiogram, which specifically looks at body's blood vessels, whereas MRI is called magnetic resonance imaging. So, magnetic resonance imaging, it is used to produce detailed pictures of inside of your body. It is also used to help diagnosis or monitor treatments for a variety of conditions within chest, abdomen, and pelvis. So, in MRA, in this test, it uses radio waves, a magnetic field, and a computer to create a scan of your body parts, especially to look for any health problems. So why do we need it? Why do you need an MRA? So an MRA is used if there is any narrowing or blockage of any blood vessels in any part of your body. So if you're a healthcare provider, if your provider believes that you may have a narrowing or blockage of blood vessels anywhere in your body, they may recommend MRA. So for example, if there is an aneurysm, so aneurysm is nothing but it's a bulging of the blood vessels. So if the blood vessels is greater than 50% of the normal diameter, uh, the healthcare provider may recommend for an MRA. So aneurysm can occur in any blood vessels, but it is more seen in an artery rather than a vein. Then comes aortic dissections. So it is nothing but aortic aneurysms, which is a aneurysm in the weakened area in the wall of an aorta. If there is any signs of heart disease, to find the case of stroke, renal artery stenosis. It is nothing, it is a narrowing of blood vessels in the kidneys that can lead to high blood pressure or even a renal failure. So, how does an MRA create images? So, MRA uses a machine. This is a machine here. So, this machine is used to generate a magnetic field using pulses of radio waves energy to build a real-time images of blood vessels and blood flow within the body. So an MRA, it can be used with a contrast medium in the sense they use medical dyes, or it can be used without a medical dye. So when it is used without a medical dye, it is called the non-contrast MRA. So I have chosen an article called Vascular Imagine. So the goal of this article is to provide a more improved vascular imaging. So they use a technique called 3D MRA. So there are like two types, 2D MRA and 3D MRA. So compared to the 2D MRA, 3D MRA describes arterial stenosis more better. So arterial stenosis, it's a disorder. It occurs when the heart's aortic valve narrows. So the valve does not opens completely. So when it does not opens completely, it reduces or blocks the blood flow from your heart to the main artery and to the rest of the body. So that is called arterial stenosis. So with 3D MRA, it describes arterial stenosis more better, and also arterial occlusions are also more easily identified using this 3D MRA. So there are also a lot of additional advantages using this 3D MRA. They they include greater anatomical coverage and more accurate identification of hemorrhage. So there is this imaging protocol called this is an imaging protocol which provides sensitivity and specificity values. So it is used to determine the resolution. So for stenosis, MRA had a sensitivity of 94.6% with a specificity of 91.9%. And for the detection of ICA occlusions, ICA is intracarotid artery. So for the detection of ICA occlusions, it had a severity of 99.4% and specificity of 99.6%. However, when it comes to severe ICA, MRA had a sensitivity of just 65.9%. That means the ability to detect an FMD pattern of stenosis by MRA in the carotid vessels is limited due to less resolution. So FMD is nothing but it's a fibromuscular dysplasia. It's a rare blood vessel disorder in which some of the strong and flexible cells of arteries are, you know, replaced with cells that are more fibrous. So fibrous cells are less strong and less flexible. So with when it comes to severe ICA, MRA has sensitivity of just 65.9%. However, in one series evaluating FMD in renal arteries, it shows that sensitivity to specificity of 97% and 93%. So these findings, it suggests that using MRA to identify FMD in severe cervical vessels or ICA is possible with better resolution. So this is the reference here. I hope you all enjoyed my class. Thank you.